Jim, we were talking in our last session on the changes that we're seeing after COVID as our practices reopen. And we talked a little bit about how practices were operationalizing a little bit better for better adoption of premium services, whether it's LASIK. You mentioned also the younger patients are now coming in more readily. And do you think that's a function of them having more time or having more disposable income? Because many continue to work and maybe don't have commute expenses and other expenses. What's your sense of that?
Well, I don't think they have more disposable income. In fact, actually, I think that's a big challenge right now. People are really making the decision. What I think they're doing, though, is that they maybe didn't have more, but they decided to spend it differently. Because where people were going to travel, they didn't travel this year, and they're probably not going to travel. So they probably took a step back and say, okay, what should I be spending time on? And they're starting to look at some of their health issues. I mean, I can't tell you how many talks I've had with friends now where we used to talk about what holiday or where we're thinking of going to, now we're talking more about health. That could be my age too, but I think people are looking at their health. I think COVID has, COVID is an interesting way, has really kind of slapped us upside the face and realized that if you have your health, you have everything. My mom always used to say that. So I mean that in a serious note. I think people are taking a step back and going, where am I spending my money? Well, you provide an unbelievable service, John. I've always said what's great is my 40 years is what you do every day by providing somebody's eyesight. And I think people are thinking about that. And so procedures like SMILE and LASIK and refractive IOLs, just overall cataract surgery, has risen back to people's demands instead of pushing it off. I think that has caused people to rethink about their health care. And as we know, you lose your eyesight, you lose your independence. And independence is something nobody wants to give up.
Yeah, and it's interesting. I think we who are in the office and treating patients have more time with each patient. And so we're probably operationalizing better the discussion with patients about premium service, whether they're there, it might be a LASIK candidate or someone else. And of course, you hit the nail on the head. I think people are sitting at home and thinking more about self-improvement. It doesn't help when they wear a mask that their eyeglasses fog up. And so they're motivated and, getting rid of glasses it makes perfect sense. What are you hearing from practices about virtual consultations? Now we have legislation that makes permanent the reimbursement for these virtual medicine, telemedicine visits. Is that working well? Is that really widespread, or is it just talk and it's really happening among a few?
I think I said that when we first met, and I've even felt more bullish now. This should have happened, telehealth, and again, that's a big term. People are breaking that in, but let's just use that term. Should have been occurring in our industry pre-COVID. You just talked about something that I find very interesting. You said you are now having more time with your patients. Well, candidly, as a patient, I shouldn't have that as a compromise because you've been overwhelmed with the amount of patients. And I said, more patients, less doctors, bad healthcare. Now, telehealth has forced us to really have people not have to be in your office. First off, there's the health regulation. You can't have too many people sitting in your office, and spacing. And we all know, candidly, when you look around the waiting room, not just of any ophthalmology, but any office you visited in, a good portion of those people didn't need to be there. They could have been managed from a telehealth standpoint. So I think COVID has actually had a positive impact on transforming telehealth from a nice to have to a need to have. Now, the sudden attention from providers and payers and consumers will also have enormous consequences for the telehealth adoption. I think your patients are requiring it, payers are now willing to do it, providers are willing to look at it, and the patients are going to now demand that continuous telehealth. Now, let me say a couple of things and we can break this down, but I know how you talk to patients and they say, I don't want to lose that interaction I have with Dr. John. Well, I don't think telehealth eliminates that. I actually think it goes back to what you said. You're going to be able to have more time with the right patient. you're going to have data established on that patient. And I'm speaking to the professor of data because you're one of the leaders in this and how to utilize data. And then it's going to allow you to make a better decision. It's going to allow the patient to not have to go to the office. A case in point, my mother-in-law is in a assisted living now, and she can't go every day anymore to the, especially during COVID. So she needs to be established. Why not be able to do a telehealth visit with her and let her know the comfort that her eyes are progressing okay? Now, you did say one other thing about reimbursement, but I'll stop there because I think that's a whole separate subject. But I would just say that telehealth is here to stay. If your audience is not embracing it, they're going to be lost. And in fact, I would say they're going to be out of business because it is a medium that's going to be here. It's how you utilize it. And back to an earlier session, you better, when you're rehiring a staff member, I would hire somebody that's actually got experience in this area. So if you do have a vacancy, I would look at somebody that knows how to do telehealth accordingly and bring him or her into your practice, because this is a whole new medium. And 3 years from now, John, we're going to laugh that we weren't into it as quickly as we should have been.
Yeah, you know, I think you're exactly right that clearly patients have always been in favor of it. It's always been in their best interest to have remote ways of communicating with their doctors. We've just seen broad acceptance of it. Providers have been hesitant because, partly because we haven't had good platforms that make our work easy. With the earliest versions of doing video conferences, it's a lot more work for the doctor. And then of course, the biggest challenge has been reimbursement, which has now been put into place. Reimbursement is not as robust as it would be as bringing a patient into the office. But in many cases, you see a patient for a telehealth visit, then there's a less frequent but equally reimbursing office visit as well. So from a financial standpoint, it's taking better care of the patient, making it more convenient. And in the end, because the provider is billing not only for the telehealth, but a subsequent in-office visit, it ends up being even higher. So I think it's going to be here to stay, but there's been kind of a retraction of it. During the shutdown, practices were using telehealth because it was the only way we could interact with patients when our offices were closed. Now that we have our offices, we need to get back in the mode of choosing which are the best kind of visits to do that for. So
yeah, I would say, going back to your reimbursement, the executive order on improving rural and telehealth access that President Trump proposed, CMS is looking at those changes today to expand telehealth permanently. So they recognized it. And you said something again very interesting. I think during the time when you saw so many patients, you weren't spending the time with the patient that actually probably needed more time. And we know there's a lot of misdiagnosis in the healthcare region, less in ophthalmology, but a lot of misdiagnosis, a lot of wasted tests, a lot of wasted prescriptions, etc. So actually, this is going to be a cost savings to the overall healthcare system because you're not going to have a misdiagnosis. You're going to spend the right time with the patient that needs the proper diagnosis. And thus the patient isn't going to be missing appointments because he or she can't get there. And again, go back to our first point. Mom and dad now have kids at home. They don't have time right now to be able to go to your office. And, if you were to see them at 1 o'clock, and unfortunately now it's 1:30 because of the buildup of patients, life is changing. Your patients are under a lot of stress now during this situation. So telehealth will be here to stay. And, I'm speaking to the choir, but really this isn't for John Hovanesian. This is for your colleagues that are watching it. Get there. There are mediums coming. And we're going to probably talk a little later about what type of new entities are going to be getting into ophthalmology. I will tell you, private equity and venture are looking at companies that can provide these types of services. So they're here. And other medicines, your colleagues in cardiovascular, et cetera, they've been using them for years. So ophthalmology, let's go on because it's here to stay.
I would agree. I hosted Rania Habash on a conversation we had on telemedicine just less than a month ago at the OTS conference, which you may read about here on Helio. And that conversation is worth looking up and viewing. It would be on the viewable from the Helio website and also from Octane. If you look up the OTS, that's the Ophthalmology Technology Summit, we did a telemedicine boot camp session with Rania Habash. So worth checking out as well. Great, well, that'll wrap up this segment of our interview. And in a moment, we'll come back and we'll, in our next session, we'll talk about impact on industry, on the drug and device industry of all the changes in healthcare. Any last words for our audience in this segment, Jim?
No, I just sit there and say, listen, you know, COVID has presented us with an issue, but during these issues, the smart people figure out how to move forward, and people like yourself and the viewers of OSN are figuring this out. Let's jump on telehealth and move it forward.
I agree. Thanks very much, Jim Mazzo, and thanks for watching this next segment of our interview with Jim Mazzo on changes in the healthcare industry as a result of COVID.